historically is we've taken a drug that's worked for dogs and we try to see if it'll work for cats instead of figuring out. But I was saying it in a derogatory way.
Okay.
Yeah. So that's not too much.
Yes, we have to add that to the list of
Yes.
rules.
Yeah.
It's derogatory.
Yes.
Welcome to the Purr podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kuppenstein, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hi, I'm Dr. Susan Little.
Oh my gosh. And this is Dr. Jolle Kuppenstein. She is so on top of
I
it.
stunned you, didn't I?
I know you did.
I stunned you.
You stunned our guest. That's the main thing.
It's my introduction.
I know. And we're on video, so we're both like, whoa, what's happening here?
Got it.
She got it.
Yeah, and this is the Purr podcast.
Yes.
Did you say who you were? I don't think you
Yeah,
did.
Dr. Jolle Kuppenstein.
Oh, okay, you're still Dr. Yolker.
Yeah, I'm
Good.
just saying that.
Always good.
Yeah, Dr. Jolle, at Dr. Jolle, if you want to.
This is part two of our very interesting discussion
We had a cliffhanger.
with our guest.
Yes.
Let's let our guest introduce
Yeah,
the game.
that's good.
Hi, I'm Dr. Rebecca Windsor. I'm the Vice President of Veterinary Affairs at Gallant, and I'm so excited to be here again.
Yeah, and Dr. Windsor is a neurologist. And so if you're wondering what her career path was, it all actually ties together very logically. So make sure you listen to the first episode.
Yes.
Yeah.
And this episode was made possible by an educational grant of
Okay.
Gallant, so we're very appreciative.
Yeah, we are. Because I don't know. Have we ever talked about stem cell therapy
Never.
before? I'm not sure.
Maybe
Maybe in passing.
Yeah, I think we talked with Duncan Lascelles about
It may
this one.
have.
We did
It may have
this
come
one.
up.
That's right.
Talking about orthopedics,
Yeah.
but we've never had like an episode.
Yeah.
Right.
Yeah.
Fully focused on.
Right.
And now
Good.
2 episodes.
Yes.
Yeah,
we need more.
Yeah.
Taking over the world.
Right.
Yeah. Well, but it's time. It's
Yeah.
finally time.
100%.
Right.
Yeah.
And
So
this
we
is
talked
part-
about diagnosis last time. We talked about recognizing it. We talked a little bit about what stem cells are, which is very useful, I think, for myself too. So because sometimes you get kind of confused what it is. Now I really would like to focus a little bit on what kind of diseases. We talked a little bit about that acronym that I forgot already.
Yeah.
Feline
The
chronic
stomatitis thing.
gingivostomatitis
Yes.
is the disease
Yeah.
you're focusing
Yeah.
on. But
Are there any other diseases
Yeah.
that you're looking into?
Yeah. So I would say our next one kind of coming closely after is osteoarthritis. for
Yeah, that
cats.
makes sense.
Yep. And chronic kidney disease. So those are the ones where.
yeah, I wondered if chronic kidney disease
Yeah.
would be in there,
Yeah,
right?
yeah.
Because it is an interstitial inflammation, isn't
It
it?
is, and honestly, I've learned so much about kidney disease that I did not.
I bet.
And I think in a lot of ways it's maybe a little more hopeful. Like I used to just think this is degenerative. There's nothing we could do. These
Yeah,
are irreversible
progressive
changes,
and yeah.
I think we're learning so much about the inflammatory component that's propagating chronic kidney disease, and so it gives us a hope. Like maybe can we intervene? And
Yeah.
help slow the
That would be
progression
so
there.
cool.
Yeah.
It would be, and the thing about cats is I think they like to respond to everything with inflammation. They're just very really
Yeah.
they're in a way they're a little bit like horses. I think
Yeah.
horses are
Yeah.
very inflammatory creatures, right?
Yep.
And so cats are like,
Idiopathic cystitis.
Yep.
That's what I was thinking.
Yep, and they're looking at it in humans. And I'm writing a textbook right now, so talk about really becoming a stem.
Oh my God.
It's unbelievable. I mean, everything I look, I'm like, there's no way they're looking at this. I'm like, literally, you name it, they're looking at it. But yeah,
Right.
it's cystitis in women is one of the main things.
because that's another horrible
Mhm.
disease.
Right.
Yeah.
I mean, the cats have so many chronic horrible diseases that
Yeah.
they are. But
Yeah.
I think they're also really interesting examples for human medicine.
For sure. Yeah.
So-
And I mean, allergies in cats are becoming much more
Right.
recognized, skin allergies. So,
Yeah.
yeah. And what I think is really interesting about stem cell therapy and so promising is that we all know cats are not the same as the D word, right? And their pathophysiology is different. And so a lot of times what's happened historically is we've taken a drug that's worked for dogs and we try to see if it'll work for cats instead of figuring out. But I was saying it in a derogatory way.
Okay.
Yeah. So that's not too much.
I guess we have to add that to the list of
Yes.
rules.
Yeah.
That's derogatory.
Yes. So,
That's-
It's quick thinking.
Yeah.
And so what's beautiful about stem cells is they're not programmed to do certain thing in a certain species. They are going to figure out what's going on in the environment of that particular animal,
Right.
of what's going on with them. And so you can have differences in allergies and OA and
Right.
inflammatory bowel disease, et cetera, between the species, and they're still going to be able to function as is needed in that particular patient. So
So I have a question that's kind of left over from the first episode because it popped into my head and then I
Yeah.
forgot it. So the stem cells are harvested, and in this specific case,
Yeah.
they're harvested from the feline uterus,
yeah.
right? And so we'll talk about that a bit more in a minute. But they're not coming from the cat itself, right? Which used to be
Correct.
a
It
more
needs to come
common
from the
model.
patient.
Right.
Yeah.
And now
Mhm.
they don't.
Yep.
Right. And so, how do we know we're not going to get an immune reaction due to
Yeah.
like foreign cells,
Yep,
right?
yep.
Because they're coming from,
Yep.
right?
This is a super common question that I get because people think about blood transfusions and tissue
Yeah,
transplants and things
right,
like that. And
right.
so a lot of it is just the unique nature of stem cells. And so they have really low levels of MHC class molecules on there. So those are the main immune kind of molecules that we have on cells, right? And so if you've got a foreign cell, your body's like, hey, I recognize that MHC, molecule. That's not me. You know what I mean? And
Right.
can form an immune reaction. There's different types of immune reactions they can form. So but they have such low levels of those that they likely kind of go like undetected
Yeah.
for a large majority of cases. And it's probably species different, but I will say that humans have a really complex immune, pathway and DNA, et cetera. And so even in people where you're probably gonna have more reactions than you have in other species, only 11% of people have any sort of recognition of a stem cell. They call those alloantibodies that form. You can measure them. But they don't seem to affect the safety or efficacy. So we don't have that like as much of the alloantibody numbers for veterinary
Yeah,
patients,
yeah.
but at least clinically seeing,
Right.
what we call allogeneic cells, meaning
Right.
they're coming from a donor, being used in thousands of patients for many different conditions that we don't seem to see.
So we're
in
pretty
baby.
confident.
Yeah. Mhm.
And that probably ties back to the number of cells that are in a product or in a dose given is important, right?
Yeah.
I'm sure for a bunch of reasons, but you also want to probably assume some of them are going to get picked off by the low level immune response.
Yeah, so it's hard to know, and that's
Yeah.
so interesting. Is I think we're learning so much about what the cells actually do, and understanding that a lot of they can actually like work when they're dead. There's a whole group of research
Lordy.
now looking at what we like apoptotic stem cells and what they release when they're dead. So I think we're really shifting our concept of thinking like this has to be a live cell that's sitting there, and it's a lot of what it's secreting. We know they don't live very long in the body. This is probably why the risk for immune reaction and for tumor formation is so
It's
low.
low.
So we
Right.
think they get in, they go to the lungs first, they do some kind of magic stuff there, they then go to the tissues, and they're probably not in the body there for more than a few days in most cases. And then it's what they kind of orchestrate and initiate there that kind of takes on on mind of its
They
own.
might not have to be
Yeah.
there that long.
Exactly right.
Yeah, they just
They
need to redirect.
Mhm.
Exactly right.
Okay.
Yeah. Mm-hmm.
But given that they're not there very long,
Mm-hmm.
how often would it like a dose or an injection need to be? Because now you're making me think it would need to be like frequently.
Yeah. And I think that's what we need to learn so much more about, So I think a lot of times people have developed protocols. This kind of common protocol of giving one dose and another a couple weeks later is very common. You'll see a lot of that in the veterinary literature. So the thought is that you kind of get the process initiated, give kind of another booster dose to kind of, continue it along. But we'll probably learn a lot more like, do they need 2 doses? Could you just do 1? Do you repeat kind of as needed based on clinical
Might be patient specific
It's
too.
100% patient specific, I think. And
Yeah.
so I think that's why it's really hard to answer those questions. And, likely when we have products labeled, they'll be labeled to use at the discretion of the veterinarian.
That makes sense.
So the nice thing is that we have enough long-term data where the doses have been repeated to see that it doesn't seem to cause an immune reaction. And so kind of use
That was my next question,
Yeah.
right? If we're repeating doses sort of as needed.
Yeah.
does that
Yeah.
increase the risk?
From what we can see, no. I have personal experience using it where because I wasn't in a GCP study, I had a little more liberty to kind of
Yes.
redose as needed.
Yes.
Some of my patients had 6 doses,
Oh, wow.
most of the time, if they were showing signs of relapse and didn't see
Okay.
clinically any issues. So, but I think we just need to learn a lot more, and so I think when we get a lot more long-term controlled studies, it'll be important to know at what point do patients need to be redosed,
Right.
is it become like a recommended protocol to redose a certain frequency?
Yeah.
But I think it's going to be so patient dependent. It'll probably be more at the discretion of the veterinarian.
Yeah, yeah,
So,
yeah.
So where do you get those cells from? I mean, you already said it's
The
from a
uterus.
uterine,
Yeah, let's get
but
back to the uterus.
how do you get them?
yeah. So we have, and this is kind of really important part of the process to make sure you have a safe product. So we use uterine tissue that's coming from donor cats that are screened. This is super important to make sure they don't have any infectious diseases.
Yeah.
And the
Right.
main
Yeah.
reason for that is obviously you want to protect the patients that are getting them, but also some of those infections can affect the cell.
Right.
They
Right.
don't divide as well. They don't work as well.
It
So
won't work as well.
So we just make sure, and some of these infections, like foamy virus, for example, in cats is like an undetected virus, but
Yeah.
a lot of cats have it.
And you
right?
don't know what it might
Yeah.
do
Yeah.
in some circumstances.
Exactly. We know that it affects stem cells.
Yeah,
Not good for
okay,
stem cells.
okay.
So we've learned a lot of interesting stuff in cats specifically about that.
Okay.
So we make sure that the cells are sterile and free of everything. And so, but what's really cool is just the ability, and this is again our lab, scientists, I give them the credit because I couldn't do this, but they work their magic with these cells and can, create so many doses of cells, high quality cells just from a single uterus. And so to us, again, that's one of the more beautiful things because we wanted to create a platform that was sustainable, but also was ethical, right?
So
And
who are the donors?
yeah. So we have donors. They're not our cats. So they're
Okay.
cats that are part of a donor colony. And so
Yeah.
because we are only using the uterine tissue,
Yeah.
because they were going to get spayed anyway, we don't use the cat.
Yeah.
You know what I mean? So
Right.
Okay.
and so
I think that's important for the ethics.
Yeah.
These cats are getting spayed anyway.
they're getting spayed anyway. They
And
would
you
normally just throw that tissue away. Yeah.
Right.
And so we don't have complete control of everything, but as far as we know, they go through the process and then they get adopted out, But the good news is when you're thinking about volume of cells, there's all different sorts of volume in different tissues,
Okay.
right? And so you can get a lot more cells from a feline uterus than you would try to get from any sort of fat, really, just because
That's really
the amount of
interesting.
fat. And some cats don't have a lot of fat, and
True.
hard to take out. And so,
Right.
and then the other thing with fat is like I know that people like talk about liposuction and taking
Yeah.
out fat, but like you're not supposed to. It's supposed to be in there.
It's
know what I
supposed to
mean?
be there.
You know, so I like it that we're taking something that would just normally get
Right.
thrown away and using it
Yeah.
for something good. So,
It just gave me a brilliant idea. So, and I'm going to say it now for everybody around. So, I just want to have that, made it clear that it was my idea. But, is it possible when you have a cat and you have the cat spayed to freeze the uterine tissue for later and then use that as a
that is a very good question. So, and actually, one of the ways our company initially started is as a stem cell banking company,
Right.
and that's kind of exactly what you're
Okay.
describing, where we would get, fat, uterine tissue, testicles, and have them saved to use for later use. And so, so we still have that kind of ongoing as part of our company. But the reason we've shifted to this donor program is just for the sustainability, an ability to kind of produce mass amounts and not have the patient have to go through it. But yes,
But
that's
people could come to you and say, hey, I'm so interested in this. I want to save something for later.
Yeah, I mean, I think ultimately the cost will probably be a lot more for them to
Right,
do that
right.
that way by having to
Yeah.
go through the process at their vet, and we're so close to having products in
Right,
it. But
right.
we do have stem cells banked for a lot of people. So
Right.
they'll call us and be like, I'm ready to
Right.
use my
That's
banked
nice.
cells, and we
Right.
prepare those from them and
Right.
ship them over. So
Because I think that's I think that you already explained that the need probably is not there because they're not so immunogenic. But if people are really worried about it,
Yep.
then you could do this as an alternative.
Yeah, it's a banking.
Which is way more expensive, but
Yep.
of course.
Yeah, and then ideal in those situations, and that's the banking program that we have, is getting them when they're young, right? Young and healthy versus when they're older and sick.
True,
You know what I
yeah.
mean? That's a little bit more of a worry in some cases.
Yeah,
So,
yeah,
so-
So now we know where we get them from, and then we know there's a whole process there for you to get them ready, and then what
And then
happens?
what happens? Yeah.
Yes.
So essentially what happens after you prepare the cells, so they're living. So I was just like reinforce that they're living cells. And so for a lot of products in this cell-based line, they need to be frozen to stay viable. So
Okay.
so after we create all of the doses, they stay frozen in our facility in a
Right.
-80 freezer. And so
Okay.
the good news is we have a lot of experience because of all of the clinical trials that we've done. You know
Yeah.
what I mean? So essentially when you're ready to give a dose, we get called, it gets shipped on dry ice, and then it gets thawed at room temperature, diluted in saline, and then they administer it. So depending on the study protocol, there might be some differences in the way that it's administered. So
And so
how
is
do you
it
administer it then?
it goes intravenously.
Okay.
Yeah. And so
like the injection?
Yep. And that's definitely been a big shift, especially talking about osteoarthritis. And honestly, going to be my hope, bring a whole new category for cats because intra-articular
Yeah.
injections in cats
Right.
are
Hard to do.
extremely
Oh my gosh.
challenging to do.
They're hard to do.
And so,
They have little tiny joint spaces.
yeah, I know. And we have really, really promising pilot data for feline OA. And so the fact that we can give something IV, for these kitties, a lot of them are, multi-joint, cats.
Oh,
You
God,
know,
yes,
very
just
less
think of
common.
injecting in all
Yeah.
of those
Oh,
joints.
yeah.
And some joints you're really not going to get.
No way.
No.
Yeah. And so just a lot easier on them to be able to do that. So,
So the idea is you already said you inject them intravenously, they go to the lungs, they do their magic, and then they disperse through the body, find the spot where they need to
yes.
be.
You
and-
could be a stem cell nurse.
There you go.
know, I know. I like it. I like it. So yeah, so that makes a lot of sense. So and then we also discussed already. Normally you do one injection, but it could be multiple injections if.
Yeah, most of the protocols are giving two. Yeah.
Okay.
And then I think what we need to learn more about is do more long-term studies. The hard thing with long-term studies is they cost more money, right?
Oh,
So there's
yeah.
not a lot of them out there.
Yeah.
But in order to get a product FDA approved, you have to have a 365-day safety study, right?
Right.
So what we're trying to do with our products is, we give those 2 doses, and a big part of that long-term is seeing like, do they need to have other medications added in? When do they need them? What do they need?
That was one of my
What's that
questions.
long-term? Yeah.
Gallant is an animal health biotechnology company creating a new category of veterinary care with a pipeline of off-the-shelf, ready-to-use stromal cell therapies targeting the root cause of disease in pets. Led by pioneers in veterinary regenerative medicine with deep expertise in development, manufacturing, and commercialization, Gallant is making regenerative medicine accessible, moving beyond symptom management to restoring health at the source. Learn more at www.gallant.com.
So now focus down on like the practicing veterinarian. Let's say it's me and I have a kitty with this refractory stomatitis. What are the potential adverse effects, and what do you know about maybe the cat is on prednisone for something else even?
Yeah.
So what do
Yeah.
we know about those
For
scenarios?
sure. So the good news is from the data that we have, both from like historical stuff and honestly just looking at our own study and any cats that had to go back on steroids, is we know that they all play pretty well together. There doesn't seem to be a contraindication to giving stem cell therapy with other medications that we can tell so far. And so typically what I'll recommend is, if you have a patient that's still refractory on meds, you don't need to get them off their meds, meet them where they're at,
Okay.
right?
Yeah.
And then you would order and have the stem cell therapy and plan on doing the two doses.
Right.
So we've got, pretty promising safety data, across the board. I would say the FCGS kitties tend to just be sick, in general. I think
Yeah.
they're a lot more reactive
Yeah.
in the hospital environment. You know what I mean?
Sure.
So if you needed to, sedate or anything to get a catheter and whatever you need to kind of get them comfortable, that's a particular drug that in the studies we gave it slower. Like we gave it over like 30 to 40 minutes.
That's what I was going to ask. What would the volume be you would expect to inject?
So I don't know what the final label will say yet, but typically we'll either dilute it into a total of 10 to 20 mils, depending on what
Okay.
and then you'll just give a small amount at a time. You wait 5 minutes or so. And I will say when we see, reactions to stem cell therapy, it's to some degree, we don't know if it's actually the cells or what the cells are in. There are a lot of studies looking at like kind of placebos where they have the exact same, solution, but not the cells. And you tend to have similar sorts of reactions.
Yeah.
But they tend to be GI related, would be most common. So nausea, vomiting, hypersalivation, increased respiratory rate. That's probably going to happen about 20% of cats. So you're going to see some sort of reaction to it. It's almost always like pretty quickly after getting it. So I'd say within the first 15 to 60 minutes. It would be very strange to have no reaction and then go home and have a problem. That would be unusual. So most of the time they're going to be self-limiting, so you're just going to monitor them. And if you need to give Serenia. For some cats, I'm like, if you're really worried that they're going to be vomiters, I would give
pre-med with Serenia.
And what's the pathophysiological background? Why would they start vomiting if you inject something intravenously?
Yeah, so I think to some degree, we don't know, but I don't know. Sometimes we don't know, is it a reaction to the procedure, to the vom? Because we don't tend to see this in dogs nearly as much as we do in cats, We don't know, is it something in the solution? Is it something with the cells that they're triggering some sort of like short-lived, reaction, physical reaction, to it. So it's like, I wouldn't call it anaphylaxis because it's not typical anaphylaxis at all, but it is like I guess if you look at what's the most common side effect of any drug, though, nausea and vomiting, right? No matter what it is. Even Serenia.
Especially in cats.
Yeah, especially in cats. So that's why they're hard, because a lot of it is like, how much is this just cats? You know what I mean? And stuff. So we
have other drugs that produce, I can think of at least one other that uncommonly, but will produce hypersalivation, and it's hard to understand the mechanism, but it's self-limiting and it goes away.
That's very
so similar. It's not unusual.
Yeah, it's very similar. Yeah. And so we just recommend going slow.
So the cat has to be in the hospital for a day or part of a day, I'm assuming.
So I think to me, the biggest issue being in practice for such a long time is getting the catheter in the cat, right? So usually we'll just recommend, dropping off for part of the day. That just makes it easier. Yeah. For a veterinarian, there's nothing worse than feeling pressure to get.
No, I would do it as in clinic.
So I'd be like, we're getting dropped off for your stem cell day. So let's just say like, hey, I'm going to do stem cells on Wednesday. You would, order, this is how the clinical trials would do it. And ultimately it would be, if it's available, you would order it. There would be a shipping date that would be set. It would come, and then typically we'll have you put the catheter in first. Like, God forbid you don't get the catheter in and you thaw it, and then you would thaw it and dilute it and give it.
And you cannot give it anywhere else. So you cannot give it subcutaneous or intramuscular. You have to give it intravenously.
So for this particular condition, yes, we've studied it intravenously. They've given stem cells all sorts of different like locations and stuff, but there's definitely a difference in their ability to migrate and absorb, especially for skin disease and stuff is where we looked at it most, but versus intravenously. But yeah.
Well, you get better systemic access.
You talked a little bit about the research. Can you give a summary of what research has been done and what did they find?
Like on this particular disease?
For sure, yeah. So if we start just a brief summary of the whole background with UC Davis, they used cells that were coming from fat, but they used the exact same dose and the exact same frequency that we did. They're advisors for us for our studies. So that's one nice thing, because again, there's usually such a hodgepodge of data, but this is, at least we have several studies using the exact same protocol for this condition, which is helpful. And their short and long-term responses were very, very similar to ours, and so our study to support conditional approval, we had kind of two parts to that. Both of these are published in Journal of Feline Medicine and Surgery if you guys ever want to find them. But
we'll link the articles in our show notes.
Yeah, perfect. And so first we had a 90-day trial, which is kind of a typical efficacy trial, right? Just seeing is it going to be effective. And so looking at that, they got better over that course of time. But if you look at the 90-day mark, 75% of the cats had shown significant improvement in the owner outcome measures. The lesions are a little slower. So probably about half of cats were showing that same sort of change in the lesion score. And so we expect
at the 90 days.
At the 90, so a little low 40s there. And then we basically took those cats and said, okay, we're going to continue now for a full 365. But if you need to add meds back in, add them back in, and we want to know what they are.
Oh, because you had to take the meds away.
Yeah, we had to take the meds away to start the trial, which is not how you would do it. No. So I always joke, I'm like amazed we had as good of results as we did, because you have to make them worse before they get better. No parent wants that, right? They get panicked and stuff. So so the fact that we had that good of a response is great. In practice, you would just integrate it in with the ideal of that being
so in practice, you would not have to stop the meds.
100%. Nope.
You could give the therapy, and then look at tapering off, getting off meds over time.
Exactly right. Okay. Yep. Okay. Exactly right. Yeah. But what's amazing is that when we looked at that group long term, 2/3 of them never gave another medication again.
Oh, wow.
And these are cats that were
Okay.
dependent on steroids and cyclosporin and pain meds and stuff.
Sure.
And then the ones that did, it was really pretty intermittent. We only had a small group. I think it was 8.6% of cats ever needed to go back on like a chronic
Oh.
steroid
Okay.
or immunosuppressive. So
Yeah, for
And-
me, it doesn't make a lot of sense to use immunosuppressive drugs together with, because I would think that they would
Well, they're
suppress.
immunomodulating. I think
Yeah.
when we say immunosuppressive, we're kind of
Mhm.
not really
Yeah.
telling.
When we
Right,
don't
they're
have a
immunomodulating.
ton of data, but when you're looking at some studies looking at stem cells with steroids or cyclosporin, they seem to like play nicely together. So there was a kind of an older concept that like, oh, if you get rid of the inflammation too much, then the cells don't know where to go or how to work. I'm like, they're not doing well for a reason. You know what I
Yeah,
mean? They're
yeah.
clearly not. Their disease is not controlled. You know what I mean?
They'll
So,
know where to go.
Yeah.
The cats that did go back on long-term, say, pred or cyclosporin or whatever it was, well, was there a difference in the dose? I'm wondering if they would be able to,
That's such a great question. I don't know.
right? Like,
Yeah,
could
we'd
you
have to
get
dive
away
into
with
that.
a lower dose of
Yeah.
pred, say?
I don't know. I think
Yeah.
that's a really good
Be
question.
interesting
Looking
to-
to see if they were lower.
Right.
Yeah.
Right,
Mhm.
right, because that would be nice.
Yeah. Yeah.
Is there any research on any of the other entities like the osteoarthritis? Is it going on or?
Yeah. The osteoarthritis stuff is really exciting. So that's our next product.
Mhm.
Cats are number 1 and number 2 so
Yeah.
far. And so and we were actually granted the ability to have conditional approval for our feline osteoarthritis
Oh,
product.
wow.
It's
Already,
amazing. So we haven't gotten approval, but they are
Yeah.
allowing us to go through that
Yeah, yeah.
pathway. So we're an
Right.
OA drug.
Cool.
That's really
that's
exciting.
actually really nice and,
Yeah.
That is
Yeah.
and
exciting.
fast.
Yes. So we're kind of working hard on that. So we have pilot data. I actually presented at AVMA this time. We have some of that on our website too. But that's really exciting. We're
You have to
seeing.
come back for that one.
I
Yeah.
know.
Wow.
I know.
Yeah.
Yeah.
When
We
that
have
product's on the market, that's
yeah.
fantastic
Yeah.
because it's also because
Yeah.
I'm always so surprised that so many of the cats older than 10 years and older have this issue.
90%. Yeah.
Yeah.
It's crazy.
Mhm.
Yeah, it is
Yep.
crazy.
And you
Yeah.
don't know. I mean,
They're
I
hard to detect.
we
They
talked-
can be hard to detect.
Yeah. We talked briefly with my mango, and I'm like, how did I not see this before?
Mango.
Yeah, it's
We almost
they look
forgot
different.
to mention mango.
Oh,
Yes.
Tell us about it.
Yes. So Mango's my cat. So
Oh.
she's 13.
And
And other than her arthritis, I think she's like, you wouldn't know, but
Yeah.
no, we love her. She's very spunky. She like smacks my dog in the face.
Oh.
Yes, she should.
As she should. No, we love her. She always wants to be right with us, but like she's tolerant to a certain degree
Yeah,
of your
yeah.
petting. You know
Yeah.
what I mean?
And she
So-
has the best name ever. I
Yeah.
love that.
Yes, Yola loves
I love
mangoes.
mango. I love mango. I'm just totally focused on mango,
Yeah,
but
I
that
know.
name is
I know.
perfect.
She's
My next D will be called mango.
Yeah.
I know. Right.
Really?
Nice.
yeah. So
That's so cute.
Yeah,
so
that's
cute.
very good. So you had your own cat,
Mhm.
has osteoarthritis, so you are dying to get that product. I guess.
100%.
Right,
Yeah.
Yeah.
I've been videoing her and all these things. I'm
But
learning.
I think it's such
You
an
learn a
important
lot, don't you?
because if you live with cats with this condition and you see them, going, I don't want to say going down, but having problems with it, you want to do something, and there is not a lot
Yeah.
except for treating the pain itself.
Yeah,
Yeah.
there's some monoclonal antibody
Right.
Yeah.
Right.
Yeah.
products.
Yeah.
Yeah.
And I think just getting cat parents to recognize it earlier.
I think that's the
I think
big,
that's our big thing.
that is the big roadblock,
Yeah.
right?
Because
It's
it's so different.
recognition.
10% of cats have lameness.
Right.
I mean, it's
But
not
monoclonal really doesn't do anything about the disease itself, does it? It just
blocks the
treats-
pain.
It's
Yeah.
it's a pain. It's
Yeah.
essentially a
that's
pain
yeah. No,
therapy.
That's the
I mean,
thing.
so it doesn't
Yeah.
remove the cause.
Yeah.
It removes
Yeah,
the
yeah, I see what
Yeah.
you're saying.
Right,
Right.
right, right.
And that
Right.
would be
So
our
it's a
sentiment.
symptomatic treatment.
right.
Yeah.
And I think this treatment will not say that you shouldn't use that anymore. It's the combination again that's so strong.
Yeah,
Yeah.
exactly
Yeah,
right.
so do you
like
think-
while we're like kind of what our motto we like to think is like we want to not just have them feel better, but actually get better, right?
Right.
So like
Right.
we can
Oh,
help
yeah.
great to have them
That-
feel better. We
that's-
would never argue with giving meds that'll
That's a
make them
good
feel better.
slogan.
I like
But
that.
I know you need to put that under
Nice
there.
tagline.
Like,
yeah.
Yeah.
don't
So,
want them to feel better, but get better.
Yeah.
Wow.
Yeah.
See, this is what we do at the podcast. So I hope that Gallant Marketing is listening. The last question, because we're almost at the end again, but is the fact that let's talk a little bit about side effects and the worry about side effects.
Yeah.
Obviously, in the beginning, when stem cells came out, they got a really bad name because there were some incidences that cancers were detected suddenly. And obviously, when you have pluripotent cells or potent cells, we cannot fully control what they're going to do.
Well,
And even with these mesenchymal cells, and especially in cats, we have that condition, the interstitial sarcomas, of the idiopathic sarcomas that we have with them, and the chronic irritation that causes them. We already had some issues with injections and
Yeah.
other things, and now you're bringing a stroma cell in there.
Yeah.
As an oncologist, I always get worried.
I know, yeah. So, and that's a common thing. It's probably one of the most common things we hear. So I think number one to kind of remember is that the cells won't stay for very long. You know what I mean? So they're probably again gone within a few days. But regardless of that, I think again, going back to the data, we have to have good long-term data. So, and you have to have it for the product you're using. That's why the FDA makes you get 365 days safety data, right? So, and so we at least can say in our product, we did not see any tumor formation in the cats that we had over the course of the year. But
are you also planning to do then longer? Because I can understand. If you have a 3-year-old cat that you inject stem cells in, it probably will not get cancer at 4 years. It probably will get cancer at 10 years or later.
Right. But then how do you even know it's the stem cells?
That's a tough part.
Yeah.
It is.
Yeah.
I think, but you'd have to have a very specific set of conditions.
Yeah.
The thing though is
So for that to happen.
the advantage I think that a company is like you have is there's one therapy that you do with a lot of confounding factors, but you have all the cats that you can follow.
Exactly
I
right.
mean, for me, that makes it so
And
strong.
that's so we have those relationships. But honestly, again, going back to the Davis study, since they start so much early, they have those cats followed up 9+ years.
Yeah,
You know
so
what I mean? And
that's
they
what I
have
was
it-
going to say.
Yeah.
There is
That's what we
long-term
did.
follow-up out there.
Yeah.
So I
and have
think
it. And not just for this, for other conditions too. And what's interesting too on that note, because again, I'm writing this textbook about, and we have a whole oncology chapter, is the more and more that they're using mesenchymal stromal cells for cancer. You know what I mean? Because again, those immunomodulatory properties. So I think that'll be interesting too to see over time how much they're being.
What tumors in the human are they treating with?
So I think lymphoma is a big one. Some brain tumors, obviously that's my area of interest, like gliomas, etc. So, but you have to be super careful to your point of like knowing exactly what you're doing, and you can't always predict those environments. And like I said, these are living cells; they can go one way or the other. So you could have a certain scenario. So you have to look at it specifically. But I think more and more is coming out for their ability to help tumor environments than it is to hurt.
And what is the guarantee that you're only injecting that specific cell? Because the uterus has a lot of cells, so there might be some pluripotent cells in there too. So how do they sift that out?
So we there's markers that you put on all of the cells, you know what I mean, to kind of verify exactly what cell types there are, and so all of those are verified in the exact percentages.
That's the lab magic.
Yes, that's the lab magic.
Right.
Yep,
That's what they
exact
do.
percentages of all those.
There's a lot of stuff under the hood, you know.
We need a big shout out for those people that work.
100%. I always say that we would never ever be here without.
Because it is.
When is your book coming out? Because Dr. Susan and I both have experience with writing books and both frustration.
You think I'm crazy? My husband's like, why did you do this? What are you doing?
Listen, lady.
Yes.
I've done it 3 times. And I'm about to do it for the 4th.
I know, but it's
I
like,
need
What, did you say
psychiatric
yes?
help. I did.
Oh my God,
I
you're
need
crazy.
psychiatric help.
know,
I'm
but
just done with the second and I'm done.
like,
They're
learn
Never
so
again.
much, and I was like, even
It's
if no
the
one ever
learning.
buys this book, I'll learn so much. So
It's the learning.
Yes, yes.
That's what sucks me back
Yes.
in every time.
yeah,
the learning.
and I get to work with great people. It's a 23 chapter book, and like
Wow.
all
The other
different
thing,
organ systems. I work
you
with
work with
amazing
great
people,
Right.
learning so much. And then the book is due in March of 2027, so we'll see when it comes out. Hopefully,
Yeah.
Oh my gosh.
Yeah.
and then it'll be outdated within 6 months.
So,
It's a rapidly evolving field, though, right?
Yes.
Yeah.
I'm doing my best.
the second edition will come out in 28.
So I'm like, I have to do. You get so excited, you get a chapter done, and then you're like, look, I'm like, now I need to have
It's
5
already
more
changed.
references over the
Yeah.
last 2 months.
Yeah. That's
So-
the life of being a book editor, though,
Yeah,
right?
yeah,
Because it takes a considerable amount of time to put it together, and
Yeah.
inevitably, this is always my dilemma. It's like, oh my gosh, like, now what do I do?
I know.
Like,
I know. Just I'm not looking, not
Yeah,
looking.
Yeah.
that's it. At some point, you have to go. I'm not looking.
Yes. Yeah. Yeah.
Or it'll never
Anyway,
be done.
this has been wonderful.
Yes.
This is the Purr podcast, Dr. Susan.
We have learned a lot.
I know
You know,
about
we
stem
have-
cells and everything.
Yeah, we have learned a lot. I just, before we do our closing, I just want to reiterate what Yola said. It's an exciting time in feline medicine, and this is clearly part of us. Finally, we're getting some significant advancements in feline medicine,
Yes.
right?
Yeah.
And so the validity of the science, the data, it's it's going to go through FDA approval. All that's so reassuring.
Right.
Now
Yep.
we're finally being able to do this type of stem cell therapy the right way.
Yes,
Right.
absolutely.
So this
right.
is really,
Yep.
really reassuring, and it makes me very excited.
Yes, me too. Mhm.
I also like the fact that, it started in academia, now it's taken over by a company that's really
Yeah.
serious about
Yeah.
cat health. So
Yeah.
for me, that is
Very important.
wonderful.
Yeah.
So
Yes.
thank you so much.
Yeah.
Thank
Love
you,
it.
Dr.
That's
Rebecca Windsor.
so amazing,
Oh,
Yeah.
so natural. So now you have to come back.
I will. I will.
Oh.
Back.
You'll be a
Come back for your
repeater.
book, come back
Okay,
for
good.
Yeah.
Okay, good, good, good.
therapy.
Yeah,
So,
Yeah.
yes.
Whatever.
There's only so many people
Right.
we invite back.
Oh, good.
It's
I'm
a
so
short list.
Last question, where can people find more information?
Yes.
So probably best thing is our website. So it's www.gallant.com. We have a lot of educational information on there. We also have our own free race-approved CE platform. It's called Gallant U. And so it's very fun.
Yeah.
I do a lot, but we also get really awesome speakers to do our talks with us. So so feel free to check those out. We've got a lot.
And we'll put the links to a lot of the things that we talked about, including the website, in the show notes that are on our own Purr podcast website. We'll have it all linked there.
Perfect.
Perfect.
Okay, thank
Thank
you.
you.
This is awesome.
Looking
Yes.
forward to the
Yes.
next time.
Yes.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.